This is the progress note for physical therapy. The progress note we use is titled Recertification, and that's because as of January 1, 2008, we only have to get recertified every 90 days, but every 10 visits or 30 days, whichever is less, we have to put a progress note in the plan of care. So, set the camera down carefully, if you can see. I'll go back up. Name, diagnosis, date of birth. Okay, treatment start date. Hopefully you can still read that. January 1 to February 1, 10 visits. The reporting period, that's a requirement. I put the CPT codes in so that there's no doubt as to what I'll be billing. I've linked my CPT codes to my measured impairments down here. Pain intensity, this is the only place in the progress note where you want to talk about pain. What you want to talk about are disabilities. You should have a disability statement. This really should replace your SOAP note or your subjective. Functional limitations taken directly from the optimal score. I use decimals for the overall score, and I break it down into fractions for individual functional limitations like bending and lifting. Take your current measurement, compare it to your prior measurement, compare it to your goal. Your goal can come from, could be your judgment, could be the patient saying, this is what I want. This is part of the skilled aspect of physical therapy, setting goals. You should go ahead and explicitly say, here's why I set the goal this way. Okay, that's where you can get into your comorbidities and your complexities and things like that. Impairments, okay? This is where all the fun happens. Measuring these impairments in range of motion and strength. Notice supine straight leg raise, PT 101. You learned that in school. Faber position. Side-lying right hip external rotation. This is one we do that's, I think, commonly measured, but I put it on the website at www.simplescore.com. Note we have the current measures compared to the prior measures. See if they're better or not. Compared to the goal, see if you've met your goal. You can use opposite non-involved extremity, or you could use a standardized sample or normative data set. If you're going for that second month, you ought to go ahead and put in a new goal. Here's how we're progressing the plan of care. Okay, something a little more additional that you're trying to get. We use recommendations for our justification statement. In this case, I don't have one. That's sort of a routine statement, but you might say physical therapy is justified because the patient is making progress towards their goals, is expected to return to work, something like that. Your PT signature, the date you signed it, and you can make it out down at the very bottom. Let's see if I can get this. I'll just tilt the camera. There we go. Physician's signature. I certify that physical therapy is medically necessary. That's a holdover from the olden days. The physician cannot certify the medical necessity for physical therapy. That's what we're doing here. That's what we're measuring here with our impairments in range of motion and strength, our limitations, our functional limitations. This sets the medical necessity for physical therapy. Okay, we're linking the impairments to the functional limitations, and we're saying that this causes this, and physical therapy is going to be addressed to these, leading to improvements in patient function. So that's it in a nutshell, about 4 minutes worth of how to do a physical therapy progress note. If every component of your progress note is included in your daily notes, you don't need to do a separate note. I recommend going through the motions to do the complete progress note, making that justification statement, and just covering your bases. Make sure you've dotted your I's and crossed your T's. Makes for good physical therapy.